I chose to become a primary care physician because I feel privileged that I'm typically the first physician that most people will seek when they need medical advice or help. I also enjoy treating a wide variety of ages and conditions, which I find both challenging and rewarding. But most importantly, I chose to become a primary care physician because I enjoy developing long-term relationships with the people that I care for. Well, it all starts the moment you arrive. As a new patient, you can expect to be treated with courtesy and respect, both by myself and by my staff. I also promise to listen at least as much as I talk, if not more, so that you have a chance to get all your important points across. I'll answer all your questions honestly, and I'll take all your concerns seriously. You can expect that I'll keep up to date with all the latest medical information and put that together with my experiences to come up with the best treatment plans for you. I feel that medicine is both an art and a science. I don't believe in a one-size-fits-all type model when it comes to treating patients. I tailor my treatment to the individual patient. Along with that, I try to practice evidence-based medicine, which means that I look at the treatments that have been proven most effective, and I put that together with my experience and training to give you the best treatment possible. I was fortunate enough to do both my internship and residency in family medicine at Mount Clemens Regional Medical Center. As a result, I was able to work side by side with the physicians on staff and firsthand see their devotion and commitment towards the patients that they were treating. Because of that, I wanted to come back on staff and help to carry on that tradition of putting patients first and maintaining that high level of care. I feel very fortunate to be on staff at Mount Clemens Regional Medical Center. I feel there are numerous steps that a person can take to maximize their relationship with their primary care physician. I'm going to talk about 4 steps that I think are important. The first step is to tell the physician what's on your mind. Try not to hold back information, even though it might be a difficult subject to talk about, because that can be the difference in getting the best medical treatment possible. The second point I'd emphasize is to write down all your questions before you come in to see the doctor. Oftentimes, people have questions in their minds, and during the time of the appointment, will forget or get sidetracked. Oftentimes, we remember these questions on our drive home. If you write down your questions, you can ensure to get those questions answered at the time of the appointment. Third, I would say, is to get an annual physical. Not only does it make good medical sense to do it, but it's also the perfect icebreaker with your physician. It's a good time for you to see what that physician's personality is like and what their medical viewpoints are, as well as it gives you an opportunity to share your past medical history and important pieces of information about you. The fourth thing I'd like to touch on is it's important to find a doctor you get along with. It sounds simple, but sometimes it can be hard to do because different people have different personalities. So find somebody who's available, somebody who answers your questions in a way that you're able to understand, and somebody who makes time for you when you have an urgent situation that may arise. I feel that setting realistic goals is very important to maintaining a healthy lifestyle. I would avoid diets that are too restrictive. If you'd like to have a treat now and again, you can, but just don't have them every night. I would also advocate exercising, and that's not to say that you need to run marathons, but at least get out and walk or do another type of physical activity that you find fun. If you choose moderation, you'll be able to maintain a healthy lifestyle for the long term.